For my project, I got hernia. So a hernia is an internal organ or other part that protrudes through the wall of the muscle or tissue that normally contains it. What system does it affect and how does it alter the function of the system? So hernias affect the abdominal between the chest and hips, but they can also appear in the upper thigh and groin areas if you are male. Hernias can alter the function of your body by causing more symptoms, causing swelling and pain because the pressure of the nearby tissues, and a portion of your intestine could also become trapped in your abdominal wall, causing an obstruction of your bowel. How does it affect your everyday function and well-being? So from the research, it could affect your day-to-day life a good amount, because if you do not get surgery, it can just get worse because it does not get better over time. So you get more and more pain because it's going through the muscle tissue. You cannot lift heavy things, so that affects your job if you have to. And it's very noticeable when it grows, so you have to be very careful not to puncture it because it could cause damage to it and it will cause even more issues. Risk factors for this condition is being a male, because males are 8 times more likely to develop one. Being old, because your weakened muscles. Being white, your family history, if someone else has had a hernia, you're more likely to have one. A chronic cough, chronic constipation, premature birth and low weight, and also pregnancy. So 2 clinical manifestations is swelling or the bulge of the groin or scrotum, increased pain at the site of the bulge, pain while lifting, increase at the bulge size over time of the period, a dull aching sensation and a sense of feeling full, or signs of bowel obstruction. So how can it be diagnosed? So you will feel or see a bulge and where the area has occurred. You will get a physical exam by your doctor, and in some cases you can get a soft tissue imaging that's like a CT scan that will accurately diagnose your condition. What does treatment look like? Hernias usually do not get better on their own, so surgery is the only way to prepare them. So there are 3 types of surgery. One is open surgery, which cuts into the body of the location of the hernia; laparoscopic surgery, which makes a tiny incision which they would insert surgical tools; and a robotic hernia repair, that is like a laparoscopic surgery. And for medications, you get over-the-counter and prescription medications that include antacids, H2 receptor blockers, and proton pump inhibitors. So 2 nursing interventions would be giving medications of time, feeding and bathroom assistance, caring and dressing wounds, and fixing a diet plan. What teaching would be appropriate is teaching them about what to do after surgery. You would explain the diet to follow and how to take care of the incision and how to avoid physical strain, which is important because you do not want to damage the incision site. So how can you assist an individual with coping management? So you want to get good habits, especially with the diet, becoming more healthy after you heal. And if you have any questions or anything like that, do not be afraid to reach out to your doctor. In some cases, you could go to therapy if it gets really worse. And staying on medications, getting healthy habits, no smoking, no drinking that often, things like that. So thank you.